The Hawaii Comprehensive Epilepsy Center at Hawaii Pacific Neuroscience is providing hope to those suffering from seizures and epilepsy. And here in Hawaii, and here to tell us how is Dr. Corey Liow and Dr. Darren DuGas. Thank you so much for being here with me today.
Happy to be here.
Yes, okay, we have had such a busy show, and I wanted to talk with you guys now and have a sit-down moment about seizures, about epilepsy, and how common it is, and who usually gets them.
So epilepsy is an abnormal electrical discharge from the brain, and it can happen at any age, even from child to older, and it can be caused by many different things. It can be something very serious like a brain tumor or stroke or genetics, or even something simple like drinking too much, you know.
Really?
Yes.
Wow. That's interesting to hear. And I mean, my mom would talk to me about that. She said she had hit her head as a young kid, and then she would get some seizures, and then she grew out of it. Is that common?
You can. Some seizures, patients can outgrow the seizures, especially the genetics one, you know, but others like a brain tumor or stroke, they usually do need to be treated.
Right.
You know, and they do manifest, patient usually present, it can be a staring episode, or it can be progress to something more commonly known as the grand mal seizure, you know, the really dramatic convulsion that people see, you know.
And then how would someone get diagnosed if they in fact have epilepsy?
Right, and that's a great question, of course. So with most things in medicine, it always starts with kind of a history, right? And in epilepsy, we call it semiology. We want to see what actually happened during the seizure. And unfortunately, in epilepsy, most of the time, the patient can't tell us. We usually want family members or friends, someone who witnessed the seizure, to come tell us kind of what happened, because there's hints from the semiology of what happened during the seizure, where in the brain the seizure might have come from, or if it's even an epileptic seizure or not. There's things that can mimic epileptic seizures. Otherwise, with people who have their first seizure, because we've talked about these things like brain tumors and other lesions in the brain, MRI is very helpful, and sometimes we can see clues on an MRI as to where seizures may have been happening in the past. And then I think more the standard for us in epilepsy, and what we do at our clinic, of course, is EEG, it's called.
Okay.
And that's when we do the brainwave study to look for kind of hints of epilepsy on those studies to help diagnose.
Right, and then, I mean, whether you had one seizure or maybe you've had multiple, what are the consequences?
So it's really detrimental to the patient, because having uncontrolled seizures, they can lose their memory, they can lose their job, you know. So we take finding out what causes seizures and how to get them under control very seriously. You know, that's why we do have an epilepsy center that really wants to look at that to see how we can make a difference for the patients.
Yeah, you mentioned getting it under control. What is treatment like?
So the mainstay of treatment, if someone's determined to be epileptic, is still, of course, anti-seizure medication. So these are medications they take usually daily to help control seizures. Now, the nice thing, of course, is there's many new options as well. We have and in addition to these medicines that have been out for years, we also have neurostimulators now. And so here in Hawaii especially, we do a lot of what's called vagus nerve stimulation. There's also deep brain stimulators, and then responsive neurostimulators as well. And so these are all options that weren't available in the last 10 to 15 years. And then, of course, there's some patients too that we can find where they have a specific reason. They may be candidates for what we call resective surgery. So they may have a surgical approach that sometimes for these patients can be curative. And those are the patients we always want to find, those patients, to give them an option.
Wow. And then if people wanted to learn more about what you folks are doing, the innovation, the research, the treatment, where would they go? So
go to www.hawaiineuroscience.com or email us at info@hawaiineuroscience.com. And we are really, really grateful to have the opportunity to make a difference in our patients' life. Yeah. Thank you. Thank you.
Thank you for having the service, having your research center, having the epilepsy center, so people can come in, seek you folks out for any type of help that they need.
Yeah, no, we're happy, and that's why we wanted to let people know, of course, that we are available, especially for anyone suffering from epilepsy, because there is options for treatment.
Right on. Mahalo, gentlemen, for joining me today.
Thanks. Well, thanks for having us.
Thank you.
All right, we're going to be taking a break right now, and we'll be right back.